Magic does not happen within your comfort zone. Your greatness starts from where your comfort zone ends.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a special guest with many years of experience, a long and very impressive resume, Dr. Obilor. Please introduce yourself and what you do.
Thank you, Cole, for having me. And this is a special day because I know you don't have this opportunity all the time, whereby you have a large audience listening to you to learn from you, especially what you do. Well, like Cole said, I'm Dr. Stella Onuoha-Obilor. I'm a physician executive, and I have unique blend of expertise with over 18 years of experience in the space of clinical quality, population health strategy, both at the health plan enterprise level, we call it quality, value, and patient safety. So I would say including health plan and hospital patient quality, value, and safety. And I said that to say this is a very crucial space because we all know that the health of the members that we care for or the patients that we care for, we are always looking out for their best interest and also to ensure that the treatment that they are receiving or care that they are receiving is the best in class at all times. So I am very, very proud of the work we did together to fix the healthcare delivery system, especially here in the United States.
Really appreciate again you coming on, and it is a tremendously important area of healthcare. Probably one of the most important is the quality and safety. And looking at the resume here, you have a Six Sigma black belt. Of course, you have your CPHQ, but you have you went to medical school for 8 years. You got an MPH and a DRPH after that as well. So you focused a lot on getting education in this area, right? You've
Yeah.
really tried to be an expert. Just for our early careerists out there who are looking to get into the quality space,
Yeah.
what education or path would you recommend for them?
Well, cool. Thank you for that question. And I get that a lot. Like people reach out to me via LinkedIn, people that I don't even know. Many of them I haven't even met in person. And one of the things I would tell them, it's always good for everyone to understand where their passions lie. What is your why? What is your purpose? For me, that strong zeal to partake and be a partner in fixing healthcare, developing quality programs that will impact the lives of millions of members and patients. That was the key driver for me. I'm not saying that clinical one-on-one practice it's not valuable or impactful, but what I'm saying here is it depends on the passion. For me, from day one, I saw myself that I am that individual that will really do well in a platform where I have many millions of people to impact with the work that I do. And I will tell you, behind every data point in healthcare delivery system is a human story. Because of that, I don't see numbers as mere numbers. I see numbers as people, parents, friends, co-workers, siblings. So that was the key driver that brought me into here. For anyone who wants to specialize in this field, whether you're a physician and you want to do more in clinical space or even students, I have seen many students, they will tell me they don't think they want to continue to be physicians, right? Some individuals, after their 4-year program, I have seen some go ahead to have Master of Health Administration, MPH or DRPH. Whenever they ask me, what I tell them is this: do you see yourself conducting researches? Someone asked me that question. Why did I go for DRPH versus Frank PhD in public health? And my answer was this: my passion lies within developing programs,
Mm.
community and population health, care management, clinical quality, where I can develop programs, then push it to members. It's more of proactive care right? I don't want to wait until this individual gets sick and come to me for treatment. I want to be a partner with them to ensure that they understand that prevention is cheaper and safer. I'm
Yeah.
not waiting until you become diabetic. If I have to do more on educating you on what it means to do regular exercise, reduction of stressors and stress in your life, or even eating healthy, I would do that. Or take, for instance, my passion also lies in teaching people on the importance of going for their preventive screenings,
Mm.
right? So if you can just pay one day and go and get colonoscopy as versus treating colon cancer, that it's what I love, that it's what it's driving my passion. So I would tell anyone at the early stage of their career to please understand what is your why, what is your passion, where do you think that you will do more. All of this field, all of these professions, they are all equally important. But then you as an individual who is going to do this work, it's very important that you find out where your passion lies, because it's your passion that will continue to fuel the work you do every day. So that would be my advice for them. Plus, if you are getting into clinical quality, certifications will always make you stand out, right? Because if I'm looking at different resumes, like you're a graduate of MPH, or maybe you're even a physician, or what other maybe academic qualifications you have, I will equally look at, is this person a certified case manager? Is this person a certified professional in healthcare quality? Or maybe do you even have process improvement knowledge, project management? Like in my case, I have both Lean Six Sigma Green and Black belts, because healthcare delivery system is such a complex environment. You need two set of skills here to be successful. You may be a wonderful leader, you know how to manage people. But if you don't know how to lead processes, if you don't know how to streamline processes and help your team members to work on top of their licenses, then it will be equally difficult for that individual. So I would recommend them that they look and search up there and see the certifications that will be in alignment with what they are trying to do. Like for me now, I'm studying to get my fellowship on American healthcare executives.
Oh
I'm
yeah.
already a member of ACHE, but I'm taking the board exam soon, so that I'll be a fellow in that space. Yeah.
Yeah, that's. I mean, your certifications, of course, are impressive, and you can tell in the work experience that you have as well. I know you recently, not too long ago, got your well back in 2017. I guess that is a while ago now, right? But to me, it's recently. But you also got your certificate in health outcomes
Yeah.
research from Harvard, and so I think very important advice, and your passion does come through in speaking to you, especially, and you and me have similar passions, right? So I think
Mhm.
that it's easy to connect with. I think one of the questions is, what are some of the major issues that some of these students who are going to be graduating, they're going to be getting these certifications. What are the major issues that they're going to be tackling in the healthcare system today? What are you seeing out there right now?
Hmm. $1 million plus question. I wish we I wish there is one size fits all in all the problems we have within this healthcare delivery system. It's always complex, it's dynamic, it keeps changing. But I will tell you now two key things here: data, data, and data. In healthcare delivery system, data, it's everything. And I am saying that because I've been there, I've done that. Most of the healthcare delivery systems or even health plans, they struggle with data. And I say that because the data that they have is siloed, right? A healthcare delivery system, a health plan, managed care organization, whatever that platform is, you are talking about your clinical services, you're talking about your state and federal regulations, you're looking for data for your case management, looking for data for your HIDIS projects, you have data coming in-house for your risk adjustment projects, but these are in different departments. And you know what? You can even request a medical record that you already have in-house without knowing you have it.
Mm.
And that results to provider aberrations. Providers already done that, right? So we are looking for a situation whereby health plans or managed care organizations should invest in the quality of data that they have, and also create an inventory of the data they have, so that before even you go out there to request for a medical record, you know that you don't have it in-house. And also data management, data governance, right? You don't give your data into you don't keep it in the hands of vendors.
Mm,
Take ownership of your data, because vendors, I know they are good, but for you as a managed care organization, you know the type of data that you're requesting for. So you should be in the front seat to direct your vendors the quality of data you're looking for, what you need the data for. Because if I'm looking for data that I will use for my HIDIS requirements or SCQA requirements or CMS regulations, it might be a little bit different from the data a care manager is looking for case management, right? But when we get all this data from different sources, from different departments, for different reasons, if we can normalize and centralize them in one place, it becomes resourceful, and also becomes real-time data that we can use. The end goal here is to use the real-time data to manage the health outcomes of the members that we serve and ensure that we are improving their health outcomes. Because those are all the means to the end, but not the end, right? The end will be the outcome of the clinical care.
right.
So that is one of the challenges that they will be facing if they come on board. And the second one, but not the last, will be patient engagement and member engagement. It's been very difficult to increase and improve member engagement. You will ask yourself, why is that? Because nobody wants to die. It's not even knowledge deficiency. I see it as a lifestyle issue. If I continuously I'm reminding someone who is diabetic the importance of you checking your A1C every 3 months. But why is this individual not doing that? And sometimes it's not even only the behavioral issues, other social determinants of health, right? Someone comes out from admission now and we are telling them, visit your primary care physician at least in the next 7 to 14 days so that you won't go in for readmission. But have we even taken time to know if this individual, if they have transportation to visit their PCPs, right? So when we blend other social determinants and influencers of health into the care plan, into the management, into the education of the members, then I think that it's what will help us to tackle member engagement that has been very difficult. Members need to be partners in their care if we have to be successful. No matter how beautiful our programs are or our interventions may look like, even if we have the best primary care physicians within our network, if our members are not partnering with those PCPs, if our members are not doing what they should do, if they do not have good understanding of their chronic conditions, then their engagement will not be functional to the level that they will be partners in their care, that will make their understand their chronic care, be compliant with their medications and all that. So those are the key things right now that if anyone has just one quick solution to these two giant problems, maybe we would not even be talking about healthcare problems here.
Well, that is my next question is from a leadership perspective, especially on the patient engagement. And I ask that because, I'm a senior engagement partner. And so that's one of the things I'm trying to solve. So some advice from you would be very useful for me. And it's what are some solutions from leadership to try to, put in some of these solutions, get some of these solutions going in the engagement space. This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more.
Thank you so very much, Cole. And my answer may surprise you or it may not surprise you. Before we even get to the level of member and patient engagement, we need to also invest on our team members' engagement. Because it baffles me a lot when I look at big organizations. They are telling you, we need you to do this for members, we need you to do this for patients. But oftentimes, we are not spending so much on team members' development, learning, education, engagement of these team members. Nobody gives what they don't have. Before you are able to create wonderful and ultimate member engagement, it has to start from team members. Happy team members, happy members. If your team members are not engaged, chances are that you are not going to get that ultimate member engagement you're looking for. Because everyone has to understand here that it's not a sprint, it's a marathon. We have to work together as a team, right? If you understand the why you are doing what you're doing every day, you don't want to do it to impress the leader. You want to do it because it's the right thing to do. And that member engagement is a reflection of the organizational culture. If you are paying very closer attention to only the customers, remember you have two strong voices: voices of your internal customers, your team members, and then voices of the members and patients that you care for. At any point you're neglecting any of these voices, there's going to be issues. So that would be my advice for you if you're working on a project or anything. Please do not neglect team member engagement. Do not neglect staff engagement. Do not neglect employee engagement, because your success is gonna start from the team members you have, and then it's a trickle down type of event. They are doing all they have to do. It's like a puzzle. Everyone is fixing the plugs where it should belong, and then it gets to member engagement, member experience, patient safety experience, and all that.
I've seen this firsthand. I've been, I've observed teams which are highly engaged, and they somehow produce way better results with less resources. And I've seen
Yeah.
teams which are highly resourced but unengaged. And I think the question is,
Mhm.
for middle managers, especially, director level, or manager level, how are they supposed to keep their team engaged? Have you had any experience in your career where you've been able to really motivate and engage the team?
Well, I think they say seeing is believing sometimes. If you look at
Ah,
this,
yes.
if you look at this beautiful award, I treasure it. I go with it anywhere I go because it's a reminder for me to continue to do what I'm doing, and also a reminder that good work pays off. This is an award for leadership excellence and culture and engagement champion award, right?
So I've asked the right person this question.
Exactly. So I have been this type of leader that I'm a servant leader and transformational. And I said I'm a servant leader because I believe that I don't just have to tell my team what to do.
Mm,
I don't want to send the information or message. I want to be that message myself.
yeah,
I want to do things that I'm asking my team members to do so that when they look at me, if I'm doing it, it's easy for them to follow. And again, remember, if you are that leader, it doesn't matter the level of leadership where you are, but if you don't value your team members, researchers have shown that if the basic needs of team members are met, two things that they value will be being valued and being informed.
yeah.
These two things, nobody joke with that, right? And that is why I have that at the back of my mind. Every team member of mine, it's a VIP for me. It doesn't matter your role because it's not about title, it's about getting the work done. Plus, you need to value people as people, not just the work they do. Whenever a team member understands that my leader got my back, my leader cares for me as a person, they get along with you, they do the work.
Mm.
And I will tell you, at the beginning of my career, one of my team members walked up to me and said, this was way back in New York. She said, Dr. Obilor, when I do the things I do, it's you that I remember, not even the organization. And that was my direct report. I did not understand that I have to go back and, play that over and over and say,
Yeah.
why? Because I laughed and I said to her, I'm not the CEO. Why do you? He said, Dr. Will, I'm telling you, I'm not joking with you. You care for me as a person. You lead with empathy. You lead with compassion. I want to make sure that your face look good at all times.
Mm.
I give in my best to ensure that I'm not disappointing you. It was an emotional moment for me, very special in the sense that I was just doing my thing, not understanding that the way I was leading was impacting some other one's life and even impacting their productivity level, right? Because they
Yes.
remember you, they want to just not ask you, why should I jump? But they're asking you, how high should
Yeah.
I jump? So leadership has a reflection on the productivity of the team members. We should always have that at the back of our mind as leaders. So I'm someone that my magic when it comes to effective and efficient leadership, I will list them for you. Lead with empathy, lead with compassion, have respect for the team members you lead. Know that people are people.
That is awesome. Thank you for sharing that. I've been taking notes here as well for for myself. For the audience as well, though, you are participating in writing a book as well, and
Mhm.
I wanted to share
Yes.
that because the way that I think a lot of people listening to this would probably like to be under you as a leader, hearing how good of a leader you are. So please share your book, and oh, that is awesome.
Yeah, this is the book I co-authored, and the name of that book is Letters to My Corporate Sisters. Yeah, Letters to My Corporate Sisters, Stories of Endurance, Elevation, and Encouragement. I think mine is in chapter 4 of this book. My section is on chapter 4, and it's centered on being inspired by challenges. It's a true life story of mine, how challenges inspired me. When I got here from Nigeria, I was like a fish thrown out of water, left all my relatives back home, right? Friends and families. Like when I got here, I'm like, oh my God, I came here to join my husband, but at the same time, I didn't even understand that it was gonna be that way. I realized that, oh my God, at the airport, really? Do you really want to be here without everyone that you have lived with? Right? It was a tough situation. It was a tough decision. But what that inspired me to survive was magic does not happen within your comfort zone. Your greatness starts from where your
Mm.
comfort zone ends. And at that moment, I love to listen to John C. Maxwell a lot. And if you've ever listened to him, you will understand what I'm going to say now. If you really want to challenge yourself, you need to move out of your comfort zone.
Mm.
That's where your personal and professional growth starts. Your growth zone is outside your comfort zone. So, me moving out of my comfort zone inspired me a lot. And advice I'm giving to everyone, just understand that you can do it. Whenever anything is challenging, that's an opportunity. It's not a time to be in a scarce mindset. It's a time to ask yourself, what if you won't fail? What will you do? You will do it anyways, right? So that's really inspired me. I believe if I did not make that move, all the qualifications I have today, I may not even have them. Where I have reached when it comes to public, I would say, enterprise leadership or being a physician executive, I may not have reached to this level.
Mm.
But when I was challenged, I saw different colors in a rainbow. And I know that I wasn't going to fail. I started with end of mind because I know quitting was not an option. And going back home was not an option. All
Mm.
I have to do was to sit down and ask myself, what is it in it for me? What is my next level? What do I want to achieve? Who do I want to partner with? And my advice again for our audience would be, please be careful who you spend your time with. Be mindful of how you select your friends.
Mm.
Because if you are in a room that everyone is negative all the time, do not be with the basement dwellers. They will drag you down with themselves. No,
Yeah.
yeah, for real. I'm
Yes.
not being judgmental right now, but I don't really, because myself, I am someone that I have very strong positive mindset. I have abundance mindset. No matter how something is challenging, I always see that light at the end of the tunnel because I believe that did not happen for me to fall and remain falling. that happened for me to use that as a next level
Mm.
that will propel me to the excellence I'm pursuing. So that will be my advice. Because if you have a negative mindset or positive mindset, both are equally contagious.
Yes.
So who you surround yourself with matters a lot, you know?
I really do appreciate it myself, and I'm sure the audience will as well. Of course, we're gonna produce shorts of this. I'm sure that they'll be very well received.
Exactly, yeah.
Thank you so much, Doctor, for coming on. I really hope that
Yeah,
we can have you on again as well. Because
sure.
I definitely enjoyed this personally. It's very inspiring and motivating, and also some great advice on team leadership. I hope we can have you on again.
Sure. Whenever that you're ready, I'm ready.